bow down for a word of prayer. Our Father in heaven, we are grateful this morning. We thank you because of the opportunity to gather this morning in this hotel because of the task ahead of us. We commit the meeting in your hands and we pray that God, you will guide us and let us meet the goals and the objective of the day.
You know, our theme for today is building stronger supply chain with data. Now that you know each other, I want you to come up with a slogan that talks about data, that talks about supply chain on your table. Come up with a slogan. Once you come up with it, write it boldly on that white card. Your slogan needs to be catchy in a way that you're promoting supply chains, in a way that you're promoting data use. In God we trust, everyone else bring data. Stock yafikisha dawa. Hiyo lazima itrend leo. The goal of this workshop is to look at what inSupply has been doing. We want to go through our achievements. We want to identify what we have done. What are the gaps and opportunities at the end of the day? Some of the objectives for this workshop are, number one, to identify and also relate with the vision of inSupply. Number two, we want to hear from the counties. Number three, we want to look at, there are some approaches that have been really good. Can we sustain them? So we want to look at, can other counties also adapt them, and how do we go about sustaining them? Number four, which I had mentioned earlier, is looking at gaps and opportunities. There are obviously some gaps, so the counties will share with us what challenges have they seen. And we will also share, are there opportunities? We are in the digital age. We have some hashtags. Nani ashasikia hashtag? We want to make this event trend. So please tweet, please retweet. Our hashtag is hashtag scale project, hashtag inSupply DU 2021, hashtag data use.
That's my introduction. The issue of technology is very important, which is one of the areas inSupply is competent and working on the same. Without commodities, we need to be a big challenge. There's a lot of stockouts, there are a lot of problems in terms of distribution and all that. So I think this system gives us an opportunity on how to manage the same. But under the system, I think more importantly to me, is how it brings in people to work together. The synergy and the modules actually to do the same. Many people talk about how can we work together, how do we bring people in terms of coordination and consensus. But actually, when you go through the packages that they have, the learning packages, it actually does that quite well. And I think we'll hear about the impact teams.
So a little bit about who inSupply is. We're a very new organization. We are an East African organization. We're headquartered in Nairobi. We have an office in Tanzania. And every single one of us on the team is from the countries we're in. So I'm Kenyan. The whole team here is Kenyan. The Tanzania team is led by a Tanzania. And that is deliberate. That is part of who we are. We believe in locally led, contextualized solutions. We're affiliated with JSI, so we co-create, and we're very committed to both innovation and sustainability. If community health volunteers don't have products, they lose trust of the community. We've invested in service delivery. We've invested in so many things, and when the commodity falls short, then all that investment is lost. But the problem with building a strong supply chain, you can't focus only on one outcome. You have to understand the whole system and invest in the whole system. So we believe a lot in investing in processes and the system. Our signature approach is to really put people, process, and data at the center of our solutions. And the projects that we'll hear about today, we've had the privilege of partnering with 9 counties. We work with 43 impact teams, which cover 53 sub-counties. And we have worked with 281 community health assistants and over 3,500 CHVs, community health volunteers. They are our frontline workers, and they're the ones who we really miss today, but who are represented here in the work they do and in their spirit. So just as I've mentioned, we've tried to partner with the ministry, the national, the county, the sub-county governments at all stages. In design and co-creation, the impact teams, we deliberately formed human-centered design teams and went out and heard from everyone. How can we improve impact team design? The goal for today is to learn from each other so that we can help improve ourselves, but also scale up what works.
And just very
So,
quickly,
thank-
before even we move, I want to introduce the project that we've all heard about, the acronym SCALE. So SCALE is a project that is implemented in 4 of the hard-to-reach counties in Kenya. That is Wajir, Mandera, Turkana, and Samburu. And SCALE stands for Supply Chain Alternatives for Last Mile Equity. And all that builds into the UHC agenda that we talk about. And what we've seen with SCALE is that it focuses on different implementation aspects. And we're going to have this opportunity for us to see what has been happening on the counties. So the first
the learning
opportunity-
packages, as we've seen, we've had again previously, is a self-directed online-based modular. It's online. You can go in there on any time and access it, and you're able to learn different things from it. And who is targeted to do it? The impact teams members from the sub-counties are target, and the county data review teams and supply chain commodity management teams. And I feel like it goes down even to facilities, because at any given point you really need these skills, be it data analysis, be it organizational skills. Everyone needs this. So it's not only the teams, but anyone can interact with it. And the reason for this is to build capacity for teams to ensure that we improve our health supply chains and perform the tasks better, optimally, through the use of the data for decision making, problem solving, and action planning.
But there was a gap in Wajir County, and inSupply came and filled in that gap. The people were there and they were ready. They took up the task, and as a result, we have had some tremendous achievements. One of them is that there was timely and coordinated impact meeting throughout the county and the sub-counties, resupply of stocks to the healthcare facilities with shortages. The CHVs have really taken up the C-stock, and they've owned it up very well, improving on the reporting of the commodities.
Well, we know impact is about technology and data, people, processes, as well as principles or policies. But our county is more people-centered. Where we say our slogan is all about you. So the practices, so far as best practices are concerned, would be action planning and sharing of minutes in good time. Prior to inSupply coming in, we would have those minutes tarry for even as long as 1 month until the next meeting would be held. But now these ones are shared almost real time. Improved reporting rates, data quality for decision making, and improved health outcomes. Insofar as mobility, decreasing mobility and mortality is concerned.
So in Siaya County, you have 2,128 CHVs and 221 community health units that are implementing community health services, and they are fully functional. But out of that, we have some CHVs and community units, as indicated there, that are supported by partners to be able to effectively do their services at the end of the day. While trying to track the stockouts and commodity availability at the individual CHV level was something that was not possible at all times unless you go for a support supervision, and that was dependent only to the partner supported. So through C-stock, which was pegged on various areas, use of mobile technology, which generated to user-friendly dashboards, and the impact team to support the process, we were able to do and train both the CHVs, the CHARs, the sub-county health management, the county health management, and also part of the executive on the process of how we can use mobile technology to collect data, which will be used through a user-friendly and generate a user-friendly dashboard. And through meetings for impact teams on a monthly basis, you could generate information from the dashboards to make decisions on what best can be done to supply this information. And I can quote one of the CUs in our sub-county. One CHV felt that she is glad and happy that C-stock brought the national program up to her level. I remember Dr. Salim, you were in that meeting, and she was very happy that her good work actually brought people to come and appreciate her.
When we started, our reporting rates were as low as 60% for family planning. There was poor data quality, incomplete reports or reports with the variance, that is ending and beginning balances. We had high stockout rates at the facilities, high wastage of vaccines and low vaccine coverage. Lesson learned, proper understanding of key performance indicators and consistent data review is key in improving and maintaining key performance indicator. Then use of data in decision making improves performance. Scheduled, consistent data quality assessment, such as the platform provided by Impact Team, improve the availability and quality of data of an organization. Teamwork is key in achieving agreed upon actions. Feedback and deliberations is important for implementation of action plans. Follow-up on action points is important in ensuring their implementation. Support supervision is not the only effective way, because previously people used to go for support supervision without knowing what they are going to address. So the impact team approach, where you look at the data before you go for support supervision, came in to improve. Every team member has a role to play, and lack of motivation is a silent minimal.
So Turkana has been implementing SysTalk in 3 sub-counties. We have Kibish, that is near Ethiopia. We have South, bordering West Pokot, and then we have Loima, bordering Uganda. So we have 7 sub-counties, but where we are implementing is only 3 sub-counties. So we can see a gap there. Challenges still existed, and CHVs had difficulties in reporting, among a number of obstacles in executing their work, including challenges in managing health, commodities, low literacy level, inadequate reporting tools, that's what we are facing even right now, low capability to complete reports because of the literacy level, an existence of avenue for submitting community reports affecting product availability, inadequate access to health services, especially in arid and semi-arid areas. That's where we are as Turkana County. We are in arid and semi-arid areas, whereby we don't have even public transport, where CHV walks for like 40 kilometers to go to the link health facilities. That's where we are. So we've trained 200 CHVs who are given the feature phones in 17 units, as I said. 200 CHVs have smartphones, a courtesy of inSupply Health and Telecom. That is a plus to us. CHVs are able to document the number of commodities they receive, which, when compared to monthly consumption, guides the facility in charges in forecasting and quantification of commodities required at the community level. Lesson learned, the reporting using phones in Turkana has enabled team to have data for decision making through the impact teams. And in Turkana, the Mulikamuis that we are using, it is very key for reporting.
What stands for us out clear from this implementation, it has come out that the way my sister just said, we are from hard to reach counties, and it has become possible that we can be able to implement this program for that matter in the nomadic setting. Because the 3 sub-counties where we are implementing this program, it is in the nomadic and semi-nomadic communities. These are pastoral communities who have no specific area to stay, so you have to move with them, just from the lesson learned from the nomadic schools. So it is possible to implement this. And maybe now, maybe the only thing that is going to come, that's going to be a challenge, how we are going to track maybe at the end of the project. That is one thing that we are looking to. The issue, the impact teams and all these things, it has become very possible. The counties have brought the issue of the child recruitment and all that. The CHVs are already within the communities. So supplying those stocks of those CHVs who are in the nomadic setting was something that stands as for us out clear, that we can be able to cascade as we proceed in the years to come. Thank you.
The vaccine potency. We all know without potent vaccines, there's no program, isn't it? So in Mombasa, we have been involved in trying to maintain the potency of vaccines and trying to visualize what happens in the facilities. Varo is a mobile app, has enabled our facilities to capture temperature data from widely deployed the 30DTR loggers, that is the fridge tags, using an Android phone and a provided OTG cable. So this is an OTG cable. Basically, it has a USB connector on this side, and this side, it is able to connect to the phone. So once you attach it and connect to the phone, and you have the Varo app in your phone, it is able to generate a file. And basically, it is a 60-day file, a PDF file, that shows you how the fridge has been behaving for the 60 days. Lessons learned: it is possible to monitor and maintain vaccine potency in our facilities if we employ the right technology. So this is very interesting because I sometimes sit on my desk and talk to myself because the data is also talking to me.
We are privileged to have with us this afternoon 5 distinguished panelists. Let's appreciate the panelists as they come. All right, so I'll first begin by having a round of introduction for the panelists.
My name is Dr. Gilchrist Lokoel. I work for the county government of Turkana as the county director for medical services.
My name is Beatrice Buabi from Nairobi County NMS, Quality Assurance.
Dr. Mohammed Anif, Department of Health Services, Mombasa County, County Pharmacist.
Dr. Tindi Felix, Pharmacist, County Director of Health, Siaya.
And finally, Dr. Masibo, the Director for Health for Nzoia County and the Acting Medical Superintendent for Kitale County District Hospital.
So this first question goes to Dr. Masibo. I would like to ask you, what does sustainability mean from your perspective?
I think every time we encounter that word, people tend to think about resources, about finances, which is, according to me, or in my opinion, just one of the facets of sustainability. I think sustainability is also about the attitudes, the work ethics, the processes. For example, inSupply has been in our counties for a long time. Other than just investing financial resources, they have also capacity built the teams. And so there's a way they have been working. There's a process. There's a network in terms of how they do their work. And that also needs to be sustained.
Okay, next question I would like to ask Buabi. Nairobi County has been implementing the impact team approach for 2 years now. How do you think your county has integrated sustainability in the program design of impact teams?
Thank you very much, Anyona. Nairobi County, working together with the inSupply, has embraced the issue of sustainability in issues of impact team in 3 ways. One way that inSupply came in with was working with the existing structures. And the existing structures from the county, sub-county, up to the facility level has paved way for the county to follow up through those channels to make sure that the gains that have already been achieved will continue to be there even after this program has come to an end. inSupply came in with technical support, and the technical support was rolled down to the sub-county and even to the facilities. Now all the facilities in our county have been empowered, and they are able to meet every month and look at their data, identify the gaps, have a change package, and work towards improving on their gaps. This is something that is already inbuilt in the facilities, and this is the way to go.
In Turkana County, inSupply Health has implemented a number of interventions, impact teams, C-stock, learning packages, potency, etc. So from all those interventions that we've been working on, what in your opinion has worked that you would like to continue, that you want to carry on and sustain beyond the project period?
You see, when you have, God blesses you with children, and then somebody comes and tells you which of the following children do you prefer. You see, you will be at pains to explain which one is your favorite, even if you know it exists. But sea stock has actually made a lot of impact in Turkana. This is a situation whereby, if you recall the earlier presenters who mentioned that the whole purpose of inSupply, previously JSI, was to ensure that how can these commodities reach the far-flung areas, hard-to-reach areas, while at the same time minimizing or reducing stockouts. So by and large, yes, the inSupply, modules, the inSupply packages that have been brought to our county have actually played a big role, and we are happy.
Thank you. Let's hear from Dr. Hanif, please.
The impact teams have been able to, own the data. The sub-counties have been able to own the data that is generated by the facilities within those sub-counties. So there is ownership, and with impact teams, they have been able to improve in the reporting rates, and the quality of data has also improved.
Who are the key stakeholders that you have identified in your journey of sustainability in your respective counties?
And stakeholders are very key. And I would say that it starts with the reorganization within the department. And I'm talking about reorganization within the department because we do appreciate that we have a strength that in county government and also in government sectors, there's systems which are already in place. These systems just requires a lot to be done around system strengthening, so that different issues which needs to be tackled, which probably are weak, when they're strengthened, we can produce the maximum out of it.
The future of healthcare in Kenya or in the world is going to be primary healthcare. And facility in charges, as is rightly put it, are supposed to prevent things from going from preventive to curative. They have a role, a very big role. Some of the things he said, the facility, the community health units are actually linked to a facility. The facility in charge is actually the secretary to the health facility committees. So the two roles should actually be complementary rather than conflicting.
Thank you very much. Great question from the virtual participants. I think I'd like for us to close it at that point. Please, a big round of applause to appreciate our panelists.
Right now, we want to go to recognition, reward and recognition. Yeah, when your work is appreciated, you feel nice. This is when we were conducting our human-centered design research. We realized that motivation is one of the key aspects of motivating human beings to perform better. And the first category we will look at is the learning packages. Okay, the first award, this goes to the county with the highest proportion of impact team members that have been certified on the learning packages. Our winner from the scale county is Samburu County.
Best Supply Chain Impact Team in Samburu, awarded by inSupply Health.
The next one is going to Nzoia County. Congratulations, Nzoia County. The second category is coming to the best impact team on learning packages per county. So the winner in the scale county is Tarbaj Impact Team. Well done, Team Wajir. They actually had 100%. And the online participants from Cherengani, congratulations. The overall winner for this category for Data Use County, drum rolls. Embakasi East and South. Congratulations, team.
There is one thing, if you forget about everything, remember that human beings everyone want to be recognized. So at this stage, you'd want to award on technical competencies. The second runners-up come from Mandera County, and this is Mandera West. So we thank you, Daktari. Pass our congratulatory message to Mandera West. The first runners-up, Ruaraka Sub-County from Nairobi. Thank you, Ruaraka team. Have a photo. And the winners for this category, Nzoia, and that is Endebess Sub-County. Endebess Sub-County. We want to recognize Endebess and give them a kettle, family planning reporting. Endebess, as Endebess are coming. Dr. Tindi, thank you for coming on behalf of Game Sub-County. Thank you for that. So we are going to give this to Mukurweini Sub-County on behalf of the team from Mukurweini, please, for outstanding performance, ensuring that they are consistent in meeting, and please continue. The team Tarbaj from Wajir for being the first runners-up, and you must be able to do planned recognition. So thank you so much for that.
Done. It's been a long journey to get here. Someone said, start with an exit plan. I had a comment from this side of the room. Every project should start with an exit plan. And we hope that as inSupply, that is something we're going to take up even to the rest of our partners. As we start projects, what's the exit plan? Are we building on KHIS? Is the ITT working independently? Are impact teams something we can actually use? Again, as inSupply, co-creating. We want to create together, because when we create together, then we own it, we sustain it, and we move in whichever county we are coming from. Primary healthcare is the core of what future healthcare is going to be. Start with the end in mind.
What partners and donors are doing to ensure sustainability of such, and of course try to discourage dependence on them, is we are trying to encourage governments or programs to plan using actual targets. What are you targeting to do? If I can narrow myself into vaccines, you go into micro planning starting from the lowest level. Somebody here mentioned of bottom up. Have those targets set from down there until the national level. Then you can focus and see what will be requiring in the next several years to come. Then look at what is available.
We want to see this progress sustained. We want to see inflow of data continuing. We want to see better supply chains at the end of the day.
But saying thanks to all of you. It has been a very long day, and but a very fulfilling one. I think I've learned so much from listening to all of you, and I really appreciate your active participation, your commitment, your passion. Sustainability is not just about the resources. Sustainability is about the attitude and the mindset. And I want to thank and recognize everyone in this room, because you are leaders in that attitude and mindset and in that commitment for data use, for supply chains, for health for all. And just give yourselves a big round of applause for all your work, not only today, but over the last several years. But thank you to everyone who joined us online as well. I wish we could see your faces. I wish we could all be here today. But you were well represented in your questions, in your tweets, and hopefully your county leaders will come back and share some of this with you today. So a big thank you to everyone, and I can't end without thanking the inSupply team. They're a really great team. I know many of you have worked with them, and I feel very privileged to work with them as well.
Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
It is my hope that this good work that has been done by the 4 counties can be replicated in the other 43 counties, because of the biggest impact that it has on health of residents in those respective counties. If every county replicated what you are doing, then half of the problems that we have in our country would be addressed. Going into the future, we are planning to engage all the 47 counties, take you through the strategy so that you understand we are here to complement the good work that you are doing. Anytime you get stuck, don't hesitate giving us a call, paying us a visit. We probably could have solutions of some of the problems that you are encountering.